welcome. So what we're going to basically look at today is pretty much more the acupressure aspect of things and how complementary medicine is actually utilised, particularly for the management of low back pain and more the use of it in general, across whether it's the UK, America, Asia. So we just look at the difference between the different parts of the world as to the utilisation of complementary and alternative medicine. So the aim of today is to raise your awareness of the use of complementary medicine in the management of low back pain, and also by the end of the presentation hopefully you'll have an evidence-based use of complementary medicine for the management of low back pain, and also with regards to the use of acupressure for the management of low back pain. And also what we'll take a brief look at is more of the use of self-administered acupressure for low back pain. This is something I use with my patient quite frequently, so this is something which I hope to introduce some of you to also. So if we start to look at the use of complementary medicine, particularly here within the UK, a survey was actually undertaken looking at 4,862 subjects, and what they basically found was 16% of those actually used a complementary practitioner. Now, the main areas why they were visiting complementary practitioners was primarily for physical therapy aspect of things, particularly for the management of musculoskeletal disorders. And the main musculoskeletal disorders that they were actually looking to be treated was particularly mainly low back pain. So once we start to take a look at that, the main complementary or physical therapy that they were actually utilising is massage, osteopathy, chiropractic, and also acupuncture, as well as other key things which you can utilise to treat your low back pain, such as yoga, Pilates, and also reflexology. So once you start to look at that, with regards to the treatment of that, acupuncture was one of the key areas which was actually addressed within that. Now, if we take a look at the Canadian population, particularly over the age of 18, what they basically found was approximately 17% of those would actually go to a complementary practitioner for the musculoskeletal disorders, and particularly mainly for the management of low back pain. Again, the main practitioners that would have been seen would have been physical therapists, looking at massage therapists, chiropractors, and also acupuncturists. Now, if we take a look at America, results was again pretty much the same. Particularly once you start looking at the management of low back pain, majority of those would see a chiropractor, massage therapist, and then that would be closely followed by an acupuncture practitioner. Now, those findings was pretty much similar to Germany, where you've got 13% of those particularly looking to get treatment on the low back. 13% of those would actually see a acupuncture practitioner. So that's pretty much similar to what it was in Germany. But once we start to look at Korea, then you start to see that the majority of the subjects would actually go and see an acupuncture practitioner or a medical practitioner, doctors, or somebody along that line who would actually administer acupuncture. So it depends on where you are. So once we start to look at China, for example, where acupuncture originate from, then again everything's pretty much the other way around, where if you look at America, the majority of people would see a chiropractor or a massage therapist. That would be the biggest proportion, where here it's the other way around. The chunk of 60% is actually going to see somebody who administers traditional Chinese medicine, mainly to treat their low back pain. That would be closely followed by massage therapy, which would be 41%, and the least would be chiropractic treatment, where if you look at the numbers and the figures on these, this would be the other way around once you start looking at more the Western world, where it was pretty much more the chiropractor which was taking the majority of treatment for the management of low back. So again, geographically, depending on where the treatment is, will determine as to who's going to receive the key type of treatment with regards to acupuncture or the physical therapy side of things. Now, that brings me on to the acupressure. So we've not talked much about acupressure, but however, as we looked at with regards to when we was treating myofascial trigger points as to how effective acupressure was in comparison to actually needling or dry needling. So you can see it is a very, very effective treatment modality, and I think it's something that whether you're applying acupuncture or dry needling, it's something you do need to pay more attention to. Now, if you go back about 10 years ago and you look at the research with regards to acupressure, it was pretty limited. But however, you look at the research that's available now, there's significantly more research that's now available. Now it's becoming more widely recognised and accepted more into the healthcare profession. And particularly if you're looking at primarily treating low back pain, one of the most effective treatment modalities for treating low back pain is shiatsu massage. That's where you're going to actually apply massage combined with pressure. Most important thing is what points are actually being utilised in order to address the back problems and things like that. So you do need to target your points and be more specific to get the best treatment outcome. So we'll take a brief look at that in a second. But however, what you basically find is, just to give you a quick reminder, is acupressure is believed to be the mother of acupuncture. In other words, it came before acupuncture. So therefore, before acupuncture, came about, it was mainly as acupuncture was more accepted into the medical profession, and needles were started to being used within those because it was easier to apply in that respect, and you could put the needles in, leave the patient. Whereas here, if you're applying pressure, you do need to be stimulating that point, then move on to another point and stimulate. Whereas with needles, you can treat multiple points over a certain time period, less pressure and what have you on your hands also. So it does have its advantage, but however, it has been shown that in a number of cases, and particularly if we look at the clinical effect overall, you are finding acupressure can outperform acupuncture in that respect. So that is something to bear in mind. The other time when it comes into its own is when you give it to the patient. So in other words, besides you applying an acupuncture aspect of it, give them pressure points to go away and stimulate. I find it shortens their overall treatment, and also it gives the patient something to do where they can actually get involved. If I'm treating certain conditions, where particularly if it's psychological conditions, then that is where your pressure on giving them pressure points to utilize comes into its own. So it is important that you do give your patient pressure points to go away and get them to apply those pressure points themselves. Now, again, it's one of the oldest form, as we're saying, pretty much more like massage, and in the lays, for a lay person to be actually applying it, it is quite an effective treatment modality to actually utilize. So if you look at any research and anything to support that, if you look at a systematic review that was undertaken, that was looking at 23 randomized controlled trials consisting of 2,400 participants with low back pain. They found that overall acupressure was superior to your general physical therapy and also usual care. So you have got quite a strong treatment modality. So it's not just me telling you it is. There are research out there that is actually demonstrating it is a very effective treatment modality. So I do believe it's something you should employ into your day-to-day routine if you're applying acupuncture. And you can give that to the patient. As I was saying, is you can give them self-administered acupressure. But one of the key things that I found is once I start to look at the points that's actually being used. So if you look at the overall RCTs that was actually involved in this systematic review, you find the main points that was actually being utilised was your gallbladder points, which is your gallbladder 30, 34, your urinary bladder points, your main point being your urinary bladder 23, 25. Those two are key trigger points also. A very important point would be urinary bladder 40. Again, that's a trigger point, but that's for your knee, but it's also an effective distal point for treating the low back. Urinary bladder 54, which is a little bit higher up than the gallbladder 30 in the glutes. Very good for any sciatic type pain, referred pain, piriformis. Those 2 points are quite good for that. Urinary bladder 57 and urinary bladder 60. Now, what I do find, whether it's acupressure or whether it's your manual acupuncture, is the main point that I have found missing out of all these studies in my research looking at low back pain is your urinary bladder 51. I haven't found a study that's actually utilised urinary bladder 51, come to that. And if you was to look at the overall effect of that point, it is one of your main myofascial trigger point that sits below that point. So as a classical acupuncture point, it's very important. As a myofascial trigger point, it's very important. What I'm referring to is in at least 80% of cases of low back pain, that point has been shown to be involved. In other words, referring pain down into the hip and into the gluteal region. So ideally, that is a point that you do need to consider and actually treat that on a regular basis as part of your treatment modality. So that's the only thing that I'm saying, once you start to look at research, not all research are choosing the best points, and that should be an important point that should be considered in any treatment protocol. Unless it's in its acute phase and there's any swelling inflammation around there, then it's not a point of choice. If it's not in its acute phase, then you do need to assess, palpate, and determine whether that point needs to be utilised. But that brings me back to the acupressure, as I was saying, is self-administered. This is a particular study that was actually undertaken comparing self-administered acupuncture, and this was showing that it was just as effective as other treatment modalities to give the patient self-administered acupuncture self-administered acupressure. So it's something that I do recommend that you should employ with your patient, and particularly in the acute phase. What I normally tend to do is to give them the ones in the hand in the acute phase. You've got your yin tang, you've got your dew 26, very good points for acute, and these are points that patients can go away and stimulate and loosen up the back, and along with your urinary bladder 40. So even though they might not be able to locate the points in the back, they can use these distal points, and these distal points have been shown to be more effective than your local points. So you do not need to be doing anything directly into the back. You can give them these ones here, and as they stimulate the ones in the back of the hand, what they're basically doing is going through their exercise, flexing, extending, and it helps to increase the joint range of motion in the back. So they are quite effective at doing that. So it is something, what I'm saying is recommended to start to consider as part of your treatment protocol. So thank you for listening. I hope you find that information I've just given you useful. I hope you'll be able to go away and start to employ some of that. What we'll be coming on to next is looking more closely at what points and how to go about selecting points based on whether you're treating acute or chronic low back pain and where the problem is actually emanating from. Look forward to seeing you on the other presentations.